Okay, so good day to you. My name is Luke ARLETA, your student nurse from the Kalayan Educational Foundation Incorporated. And today I will be demonstrating to you the assessment of the temperature, pulse rate, and respiratory rate. So before we begin, let us start first with taking of temperature. So the assessment of the temperature is a nursing procedure. Yeah, that's a nursing procedure that provides baseline data. Okay? So that the nurse can check if there are any changes in the core temperature of the patient whenever there is a medical intervention such as giving antipyretic drugs or giving temperature to the patient and etc. Okay. So the purpose of this assessment of the temperature is so that to know if the heat production exceeds the heat loss, or if the heat loss exceeds the heat production and vice versa. And ayun nga, there are 4 sites in taking temperature yung pwedeng i-take. This will be the oral, the rectal, and the axillary, and the tympanic membrane. But today we are going to focus on the axillary region right here, the kilikili, Tagalog. So, the equipments we will be needing are this one, what you call this? Thermometer, digital thermometer, cotton, and the alcohol. And most importantly is the trash can. Ayan, trash can. Nalagulan. Yeah. Now we will begin with preparing all the materials, the necessary materials for the assessment. So as you can see, I have already prepared the materials in advance for to facilitate organized and proper measurements and to avoid the loss of time. And be sure to introduce yourself to the patient. Sir, my name is Lucas, and explain the procedure to remove or reduce any anxiety of the patient while facilitating cooperation and compliance with the procedure. Yeah. Okay, now first we need to position the patient. As you can see, my patient is in the sitting position right here. And we need to expose the axillary region. Paano ba natin na-expose yan? Ganun na lang yan. Paano kayo maghubad ka? Yan. Maghubad na lang po siya para maayos yung ano. Yan. Kung maghubad naman po yung pasyente, be sure to provide privacy. So, we are in a space right now, a private space in our house. So I have provided the privacy to avoid embarrassment to the patient. Okay, so expose the axillary region. Pakitaas po ng kamay. Ayan. So as you can see, this is the axillary region. And now I will prepare. Taas mo lang. I will prepare the thermometer. Now before we place the thermometer into the axilla, we need to clean it with the cotton balls and the alcohol. And with one firm twist, clean the sensory bulb to make sure that the results of the thermometer, to make sure that the readings are accurate. So, we place, pakitaas. Yeah, we will place the sensory bulb in the middle of the axilla, right there, and place the arm of the patient down, and with the forearms placed over the shoulder, and with the bulb of the thermometer pointed towards the head of the patient. This is so because the bulb needs to be in contact with the axillary blood supply, and we need to place the arms down to maintain the position of the thermometer. So we will wait for the beep of the thermometer So habang naghihintay po tayo ng beep, let me tell you this. The normal temperature for humans is 97 to 99 degrees Fahrenheit or 36 to 37 degrees Celsius. And the average is na 98 degrees Fahrenheit or 37 degrees Celsius. And ayun na nga po, nag-beep na siya. As you can hear, sana narinig nyo na nag-beep na siya. And yung pyrexia, it occurs when the temperature exceeds from the normal range, and hypothermia happens when the temperature is below the normal range. So as you can see, I have taken off the thermometer from the axilla, and the readings is 36.3, which is in the normal range. Yeah, and ayun, we have read the result, and we will again clean the sensory bulb. Yeah. From the stem of the bulb, with a twisting motion, from the stem down to the sensory bulb. This is so because we will clean it from the least to the most contaminated area, and properly dispose the cotton ball in a proper waste bin to reduce the transmission of microorganisms. And yun nga, yung i-put away the equipment for proper care of the equipment. Ayan. Let it dry. Now is the last part is to record the data, record the temperature in a chart for proper evaluation and comparison of data. That would be all for the temperature. For the temperature taking. Up next is we will be assessing the pulse rate and respiratory rate. Okay, later. Cut muna.